Hi, I'm Dr. Malalis, and this is Dr. Chaudhary. We are ophthalmologists at Champlain Ophthalmology. As ophthalmologists, we prescribe a lot of eye drops for different varying conditions such as dry eye or glaucoma. And so a common question that we get from patients is, how do we instill these drops easily and effectively? So today we're going to go over some quick tips on how to instill them into a family member or friend if you're helping them, or how to do them for yourself. So Dr. Chaudhary, tell me what advice you give patients, and take me to through the procedure of putting in an eye drop in a family member or a friend.
Sure. So the most important things to remember is that the drop needs to fall into the eye. So you want to give the largest surface area for the drop to fall in. The way we do that is in a couple of different ways. Number one is that we want you to tilt the chin up and the head back so that the surface of the eye is a little bit flatter. The second thing is that you can take your hand and to lower the position of the lower eyelid so there's more room for the drop to fall in. After that, it's very easy. You just take the drop, and you want to be careful not to have the nozzle touch the eye, and drop it right into the bottom inside the position of the eyelid. As long as it gets inside the eyelid, if they blink a couple of times, the drops will spread out very easily over the surface of the eye.
Great. So what do you, a lot of patients, it's difficult for them to keep their eyes open. What do you tell patients, if they're helping a family member, what to do if they're a big squeezer?
Right. So if someone doesn't want you to put drops in their eyes, they're going to squeeze really tightly. Fortunately, we have a way to get around that. So what we do is that we do the same thing. If she squeezes really tightly and she tilts her head back a little bit, the eyelid naturally makes a little landing spot for the drop to fall in, which will then trickle into the eye. So if you look right where the two eyelids meet, there's a little indentation there, and if you put a drop right in that corner, even if the eyes are closed, if she opens her eyes now, that drop will trickle into the eye and it'll be effective.
Great. So now maybe we can go over how to instill the eye drops in yourself.
Sure. So the same principles still apply. So you want the patient to tilt their chin up and their head back, and then also they're going to use their other hand to lower the position of their eyelid. And then look up at the drop, and so you can follow the drop going directly into the eye. Very easy.
Great. And then just another question, what do you do or what do you tell patients if it's difficult for them to tilt their head back because of neck reasons or...
Right. So a lot of patients can't actually tilt their neck back very much. What we tell them to do is to lay down on a bed so that they don't have to physically tilt their neck. They're already laying down flat, and so their eyes has a lot of surface area for the drop to fall in. In the office, what we do is we just tilt the chair back, and it's very easy. Even without her tilting her neck, she just looks straight up at the ceiling. The drop falls in very easily.
Great. Those are some really great tips. Hope this is helpful for you, and see you next time. Thank you.